Good morning. We would like to thank SAGE's Program Committee for the opportunity to present our data here today. We have no relevant disclosures. So ventral hernia repair is a commonly performed procedure in the United States, with approximately 350,000 cases being performed annually. Open procedures remain technically challenging as complications following these procedures are costly. Thus, there's increased interest in laparoscopy. Robotic surgery has gained popularity in gynecology and urology. However, we as general surgeons have been actually slower adopters. With the increase of robotic surgery into areas of general surgery, there was paucity of data assessing its value and outcomes. So the purpose of our study was to examine outcomes following robotic ventral hernia repair in the state of New York. For this purpose, following IRB approval and Department of Health approval, the New York Statewide Planning and Research Cooperative System, also known as SPARCS Administrative Database, was used. We identified patients undergoing both laparoscopic and robotic ventral hernia between 2010 and 2013 with the use of ICD-9 and CPT codes. Patients with age less than 18, incomplete records, and those with open codes were excluded from the analysis. In terms of our outcomes, we looked at complications, hospital length of stay, 30-day readmissions, and ED visits. We first performed univariate analysis. However, we saw that our demographic populations were very different from each other. Thus, to minimize the marginal differences, we used a propensity score analysis. P-values less than 0.05 were considered significantly. So there were 20,876 patients in the laparoscopic group and 678 patients in the robotic group. Univariate analysis actually showed that the robotic group had much worse readmission rates, ED visits, length of stay, and any complications, as all of these are actually statistically significant. So because of that, following propensity score analysis, which we basically did a case-by-case or patient-by-patient comparison with similar patients, we actually saw that in laparoscopy, there were 138 patients that had complications compared to 99 patients in the robotic group, which was statistically significant. In terms of 30-day readmissions, there was no differences between the laparoscopic group and the robotic group. In addition, 30-day visits were the same, no significant difference. And also hospital length of stay, patients undergoing robotic surgery had actually shorter hospital length of stay compared to laparoscopic group. We also looked at institutional volume and surgeon volume and whether that made a difference. And as you can see here, there was no statistical difference in terms of any readmission, ED visit, or complication. So based on these findings, we concluded that robotic ventral hernia had a shorter hospital length of stay and lower complication rate compared to laparoscopic ventral hernia. However, substratification and more clinically rich data is needed in order to determine benefit. Thank you.